Hello, Dr. Furby. I want to welcome you to this hearing. I know that you've been paying attention to some of the previous testimonies. One of the gentlemen stated that he has been participating in a number of conversations and giving input, and he feels like DCPS leadership, no matter what the people say, just isn't listening. How do you respond to several concerns or comments like that as the leader of the public school system for DC?
Good evening, Councilmember White. Yeah, we welcome input and feedback. And again, our new process for term 3 was rooted in grassroots input and feedback from family members, our staff, and those working in the school community. They really help drive and inform the plans for each school to develop their reopening plans for students and families. So their input is reflected in that. I know sometimes we don't have the opportunity or it's not feasible to incorporate every idea and every thought. And sometimes there are points of disagreement. And principals have to work through the challenge of incorporating that feedback and creating a plan that reflects the needs of that school and that community. And we believe confidently our principals have done that.
So let me ask you this. We've seen, I mentioned this earlier, some national data where 400,000 people died. I mean, I say tested positive, died as a result of COVID-19. And we've seen of that, 25% died in the last, in December, right? So the numbers are going up. What about that data are you using to encourage you to open schools and start the process in 2 weeks?
Well, we continue to lean on the expertise and the guidance from DC Health, which is also aligned to the guidance from CDC. We continue to lean on our strategies to mitigate transmission. We continue to lean on our health and safety commitments, which is a layer of protections for students and staff, which includes.
So, Dr. Furby,
yes,
based on that, you getting this information from those experts, is that data leading you to like now is the time? That's what I'm trying to understand.
Yeah, we have all indication that now is the time. We recently heard from President Biden today a sense of urgency to reopen schools as quickly as possible. And based on our own survey of our data, we believe it's appropriate at this time and it represents what we know about the science. We also recently received additional reports from the American Association of Pediatrics that also recommend to continue to reopen with schools and that schools are not contributing to transmission in the community at large.
Schools, just thinking logically, schools can't be contributing that much because schools aren't open yet. But we have to imagine where people are gathered in any type of space, it puts more people at risk, not just the students that are there, the teachers, the administrators, but their families. And so we do have to consider that. That equation, students are not at risk now because they're at home, which they are at risk, but not as at risk as they were in a contained environment. There were 1,254 families from Warday who responded to your pre-K 5 survey. Of that number, 58% said that they plan to keep their children home, learning from home. Do you have any data that identifies the primary reason for their response? And if any, what are you doing to build the confidence about those who want to thinking about returning in person for instruction?
Yeah, we always want to know how we can best serve families, and what we hear from families is that their family circumstances are different. We have some families where the parent or guardian is working from home, and they can continue to provide supervision and guidance, and believe that their child is performing well academically and socially with our remote learning model. We also hear from parents who are not able to provide that level of supervision and support and believe that it is best for their child to have an in-person experience and to be in a school building. So those experiences are going to be different by families. We also hear that families want to continue to provide as much academic support at home because their student is experiencing success, and we want that success to continue. But the reality is not all of our students are experiencing success with learning at home. And that's where we see interest in need and demand, and we want to be responsive to that demand accordingly.
So from my understanding, the in-person learning in the classroom is going to be about 11 people in the classroom, right?
Yeah, it will vary by a grade level.
Okay.
So
the reason why I'm asking, because I want to know from you, what were some of your conversations with the Washington Teachers Union as it relates to teachers coming back? Because I'm hearing through social media now, I can't verify everybody who's just saying a comment on social media, but that teachers are concerned about coming back in that capacity. That means that the teachers we already have that been in training, been in our system, know our culture, uh, may not come back. And we talking about classrooms that may was 22, 25 people in the classroom now got to be split. That will call for more teachers. How do we plan to address those type of issues? And what are we going to do with the teachers who say, I'm not ready yet, or it's not safe for me, or I have a health issue?
Yeah, so first of all, if there are teachers who have pre-existing health conditions and it's not appropriate for them to be a part of our in-person programming, we definitely have accommodations available to them that they can pursue. In terms of developing our teachers, we want to ensure that they understand clearly what our health and safety protocols are. We spent a lot of time on that this week and throughout our planning periods to ensure that staff is well versed on our health and safety protocols and what to expect in in-person programming. As you can imagine, what you heard today is there many opinions about what safe is and what safe isn't. And we obviously have heard that from our teachers. However, we've had many teachers who have volunteered to work in person and have done so in a fashion that has been very safe and effective for both them and their students. And we anticipate we'll continue to have that. We also had teachers who have had some fears, and we've had to be responsive to those fears, and we'll continue to be responsive to that. We also heard from teachers who are very much so interested in receiving a vaccine, and we work very closely with DC Health and Children National to provide that vaccine beginning next week. And so we want to continue to be responsive.
I ask you a question. My time is ticking, Doc. You bring up the issue of vaccines. Have all the teachers been tested? Or will they be tested within the next 2 weeks when school start? Just know who is positive and not and non-reactive.
Yeah, so we've sent a preliminary email to our employees working in person about the process for vaccination, and they'll receive.
Is your answer yes? Because you said yeah. I don't know.
Yes, they have. They have.
Okay.
They've received indication of what to expect for the vaccination. That will begin next week, and those vaccinations will take place at Dunbar High School.
Thank you. I have a few moments left. You said that DC Health, I'm trying to read exactly what you said. I don't want to misquote you. DC Health anticipates beginning vaccine distribution for staff working in education facilities on the week of January 25th. Given that this is the only and anticipated date, what is the plan for vaccines to not become available? Because I'm listening, hearing on the mayor's call that there's a shortage.
Yeah, so this isn't the only date. There are multiple dates during the week of the 25th. So there's a date on the 26th, January 28th, January 29th, and also January 30th as well to provide the vaccine to employees that are working in person. They'll receive a personal invite to schedule their appointment on those dates that have been provided.
There were 79 DCPS location offerings in person programming selected. How did you all come up with these particular locations?
Yeah, so those were our care programming locations or schools that volunteered to be a part of pilot for in-person programming. And that was determined by interest in their school for in-person programming and also primarily the staffing available. We relied a lot on staff that were volunteering or partners. So I know Councilmember Allen asked about where the partners fit in this. Many of our before and after school care partners have been able to support us in supporting the care model and being adults in the classroom that are supervising students that are learning remotely while they're doing so in the school building.
All right. Where do you stand on learning outside learning? Because that's been a heavy part of the conversation.
Yeah, so I'm supportive. I don't see it as a panacea, though, as it's been presented by many today. I think there isn't one solution, silver bullet to all of the challenges that we're trying to overcome with this pandemic. I think it's going to require a multitude of approaches. So those schools that are interested, we will support them. We've had more schools take on elements of outdoor learning. For example, Mann Elementary, Burroughs Elementary, Janney Elementary, Duke Ellington, Orstead Adams, Noyes. So there are schools that are implementing elements of that, and we'll support them accordingly. However, we know that, and it's been brought up today, that there are challenges with weather. At some point, you do have to go inside to use things like the restroom or meals served inside buildings. And so we want to ensure that our buildings reflect our health and safety protocols, and that's where we've invested a lot of our resources.
Thank you, Councilmember White. As I said before, we're trying for a second round. Councilmember Lewis George.